This is a demonstration of a small bowel follow-through for the diagnosis of Crohn's disease. This is a barium contrast enhanced study, so patient history is very important. So in addition to full name, birthday, and reason for exam, you're going to also make sure that you ask whether they've had any recent surgeries, especially on their abdomen, or any known obstruction or perforation in their bowels. You also want to make sure that they've been NPO for at least 8 hours. After your patient answers all those questions, you're going to have them take their underwear and clothes off and put on a gown. And I always give them a warm blanket too, because the exam can last anywhere from 2 to 5 hours and the department can be kind of cold. Then you'll give them the barium, and I use a 13% concentration of barium sulfate, and they'll be drinking about 2 cups of that, or 600 milliliters. So after they're done drinking that, I'll bring them into the room. So come up here. And we're going to do a PA abdomen. You can sit here. She's going to lie prone on the table on her stomach. This here. So I have a 14 by 17 cassette in the buggy with a left marker on the left side of the patient. I'm going to line my tube up. Make sure it's indecent. And 40-inch SID. Put in there and open it up to a 14 by 17. I'm going to center my central ray to the midline and to the level of the iliac crests. This will include the stomach especially, but every projection that you take should include the diaphragms down to the pubic symphysis. Make sure she's lined up. You can collimate a little bit side to side if you have a thinner patient. You want to measure through the path of the central ray. So I have 17 centimeters here. Barium attenuates more of the beam than regular tissue, so your exposure is going to have to be increased. So for 17 centimeters, I'm going to use 101 kVp at 5 mass with a large focal spot. And I'll have her double breathe, and I'll take the exposure on suspended expiration. So you'll keep doing this at every 15 minutes, or depending on the department protocol. It can also vary depending on how fast the barium is moving through the patient. So after that, we'll take the upright abdomen. Take this off first. Put my 14 by 17 cassette lengthwise upright in the bucky. Left marker on the left side. Let's try out of the way. Alright, you can just stand and put your back up against there. An upright abdomen is not part of usual small bowel follow-through protocol, but it is usual that patients with abdomen complaints will receive an upright abdomen. So bring my tube into 40 inches. This should have the same collimation as before, 14 by 17. And I'm going to center 2 inches above the iliac crest. And the top edge of the cassette should be at the level of the axilla. Make sure it's centered to the midline. And bring my bucky down. Make sure it's lined up. Put this shield on. Can you just hold it? Mm-hmm. Okay. Make sure her arms are out of the way. She's just going to hold that in front of her. And I'm going to measure through the path of the central ray again. About 22 centimeters. So again, she has barium in her, so 22 centimeters is going to be 101 kbp, 10 mass in a large focal spot, and again, I'll have her double breathe and take the exposure on suspended expiration. You'll continue taking pictures like this at that predetermined interval and until the barium reaches the cecum, and this will demonstrate characteristic pathology that would help in the diagnosis of Crohn's disease.